Coverage of the 28th annual meeting of the ASMBS is brought to you by Bariatric Advantage, the most complete line of micronutrient replacements specifically designed for the weight loss surgery patient. Click on this ad to order yours today.
Hey, this is Linda with Bariatric TV. I'm here at the ASMBS meeting with Dr. Jamal. Dr. Jamal released a study at this meeting on infertility in women after they have bariatric surgery. So Dr. Jamal, tell us a little bit about yourself and your practice and your study.
So I've been in practice for almost over 8 years at the University of Iowa Hospital and Clinics, and a big part of my practice is weight loss or bariatric surgery. And I personally operate on over 500 patients in the last 7 to 8 years that I've been in practice. And we, being an academic institution, have almost every year published several studies looking at particular aspects of weight loss surgery and the impact that it has on these patients. And as of last year, we looked at a particular subset of patients who are obese, who have a condition called polycystic ovary syndrome. One big primary feature of PCOS is majority of these patients are infertile or unable to conceive. So we were a little bit thrilled by some of the results that we have seen in this group of patients. And what we found out that almost 100% of these patients, after undergoing weight loss surgery, after having significant improvement of a lot of the symptoms of PCOS, some of which include hirsutism, acne, hypertension, type 2 diabetes, they tend to conceive. Almost all our patients who lost significant amounts of weight over the 3 to 4 year period that they were followed for were able to have live births without, some of them even without medical management and medical intervention, which was an extremely important finding in our study.
Wow, 100%. You hardly ever see that in medicine. Did you notice that the folks with the higher BMIs versus the lower BMIs were different as far as the study went, or was it pretty much all the same across the board?
I think to answer that question, if you look at the mean body mass index of the BMI in our patient was about 53. So we had ranges anywhere from like 45 to 73. So it was a wide range. The number of patients included in the study were only 20 because those were the patients we were able to identify that had significant follow-up to be able to be included in the study. So our study does involve a wide range of the body mass index, and we did not see a particular difference in the resolution rates or resolution of some of the symptoms or the fertility rates in these varied groups of individuals. They were almost pretty much same across the board.
Wow, that's great. That's awesome. So is there anything else that you want to say to our viewers about your study?
I think it's important to recognize that polycystic ovary syndrome, especially in patients who are overweight, is as yet not as commonly diagnosed. And it's only to a point when these patients are unable to conceive that this condition is diagnosed by an endocrinologist or a general practitioner. And what our study suggests, and the long-term implications of our study are that it forms a foundation over which future prospective trials can be done, and a larger group of individuals with this condition and who are morbidly obese can be followed for long term to see the efficacy of weight loss surgery on PCOS. And the final, the ultimate goal of any research and any study is to devise policy making. And as of now, PCOS in morbidly obese patients who are infertile is still not considered an indication for weight loss surgery. We know that some of the other comorbidities like hypertension, type 2 diabetes, dyslipidemias, and sleep apneas are currently being accepted by a lot of insurances to allow patients to have this kind of an operation. But as of yet, PCOS infertility in this particular subset of group of patients is not yet recognized, at least, to be an important factor that does respond to weight loss surgery. So our hope is that with our study and some of the other studies done in the recent future, we will have enough information to devise policy making, and hopefully people will come to recognize that infertility in morbidly obese patients who have PCOS should be considered one of the major indications for undergoing gastric bypass or other weight loss procedures.
I have another question. as the patients in your study were losing weight, did they have to reach a certain threshold percentage of weight lost before they became fertile again? I mean, was there a certain limit that they needed to reach before you noticed that happening?
So I think there are two parts to that answer. First of all, in our program, I think most bariatric centers, patients are advised to avoid pregnancy and have a definite form of contraception for at least the first 18 months, preferably 2 years following surgery. This is because of the potential and hypothetical risks to fetal development when one's body is undergoing so many metabolic changes, and to prevent nutritional complications from happening. We saw that some of the symptoms besides fertility of PCOS, like the lack of ovulation, menstrual dysfunction, they tend to resolve and respond to as low as a 10 to 15% of weight loss, which has been shown in some studies that have looked at these patients and medical weight loss measures. So with just a 15 to 20% weight loss, a lot of the symptoms of these patients tend to improve and even undergo remission. But of course, because of the obvious reasons of advising these patients not to have become pregnant at least for 18 months, we can't really correlate how much excess weight loss is required. The majority of these patients lost about 60% of the excess weight before they became or conceived. And that typically happens in the first 1 year to 18 months following surgery.
Excellent. Well, thank you so much for sharing your study results with us.
Thank you.